Today will be a short lecture on the American College of Sports Medicine's current standards on principles of flexibility. The different types of flexibility that will be mentioned today will be static stretching, dynamic stretching, proprioceptive neuromuscular facilitative stretching, or otherwise known as PNF stretching. All flexibility should be done after properly warming up anywhere between 5 to 10 minutes or during a cool down session after your exercise program has been completed. When looking at the American College of Sports Medicine standards, we adopt the FIT principle, which is frequency, intensity, time, type, volume, pattern, and progression. Any stretches that are to be completed should be done 2 to 3 days per week, with daily stretching being the most beneficial. The intensity of the stretch should be a stretch to the point of feeling tightness or slight discomfort, and the intensity should also be dictated on the ability not to hold the breath. So while you are maintaining a stretch, you should be able to breathe in and out comfortably during the entirety of each stretch. There's many different types of lengths of holding stretch. In static stretching, we should see anywhere between 10 to 30 seconds. In some older adults, we recommend stretching between 30 to 60 seconds. A partner-assisted stretch called a PNF stretching, we usually use a muscular contraction of a moderate to light load of contraction for 3 to 6 seconds, followed by an assisted stretch of 10 to 30 seconds. There are many different types of flexibility exercises that can be used to help major muscle tendon units. The ones that are most often recommended or most often seen are static stretching. The difference between static and passive stretching, active static stretching would be, for instance, an example would be you touching your toes, and a passive stretching would be having a partner assist. For instance, you're laying on your back and a partner assist with raising your leg. Dynamic stretching are mostly effective during any type of athletic or prior to beginning an exercise program like a cardiorespiratory, treadmill, run, or walk. The dynamic stretches are important because it helps increase the muscular tension or muscular temperature and also able to increase blood flow. The one that we do not recommend is a ballistic or a bouncing type of stretch. And as mentioned before, a PNF or a partner-assisted stretching should be done by a qualified professional. When we look at the volume of any flexibility exercise, any type of flexibility that you choose, we should see a total of 60 seconds of total stretching time for flexibility exercises. So you can do multiple bouts, so repetitions of 10-second holds and doing it for 6 repetitions, or 2 30-second holds. But on each muscle group, we should see that you should be able to perform each muscle group for a minimum of 60 seconds. When we're looking at reps of each flexibility exercise, we should see 2 to 4 reps, and of course we should always be warmed up. When we're looking at progression, the methods for optimal progression are unknown. The ones that I tend to recommend progression is to stretch all major muscle groups. So when we're looking at stretching the neck, the upper back, the torso or the chest, the lower back, the front of the hip flexors, your glutes, your quadriceps, your calf, and your ankles. This method of progression allows you to have a full body stretching routine to help develop the most flexibility through each major joint in the human body. So as we look at the American College of Sports Medicine current standards, again, flexibility is most often done at the end of workouts, but using any type of ballistic form or any type of dynamic form of stretching can also be beneficial.